Okay, hi, it's Dr. Buford. We're just getting started on this right knee. We're looking in the inside part of the knee, what we call the medial side. And that instrument you see, that I got you now, is called a shaver. And it has suction attached to it. So the first thing we usually do is just run the suction just to kind of irrigate the knee. As we do that, we can start to look around. As we look down at the bottom of the picture, this is the tibial plateau. And you can see some roughness in the cartilage in the plateau, especially where the shaver is right now. See if I can focus this a little bit better. Okay, and so now we're going to look at the meniscus, which is this structure just underneath the shaver there. And up here in the anterior horn, the meniscus looks good. Thank you. Now as we rotate and look towards the back, this is where the meniscus is torn. We can see right back here some fraying and some tearing in this meniscus. So we'll take a biter. Straight's fine, or curved up. Pause. Okay, so this is a biter, just basically just a fancy pair of scissors, and we're just going to start to trim the meniscus. We want to take away the part of the meniscus that's not healthy and that's torn. We want to leave as much of the good meniscus as we can. And we don't really worry about the loose pieces yet because those will all come out with suction in just a minute. But here we're just trimming back this meniscus. Okay, and so next we'll put in the shaver. And this helps us fine-tune the resection. Remember, the shaver has a little bit of suction attached to it also. So we'll show you what happens when we do this. And so already that meniscus is looking a little bit better to me. Table down just a little bit, please. Great. Yeah, that's great. And so now I think we're done actually with the meniscus resection. That looks pretty stable. I don't see anything there that could pinch. As we look down below, you can see that thinning of the cartilage. I don't see any yellow subchondral bone. So if it's exposed all the way down to bone, it has kind of a yellowish appearance, and I don't see that. As we look up at the femoral condyle, again, it looks like partial thinning of the cartilage, but I don't see any full thickness cartilage defects. So next we'll look in the central part of the knee. This is where the anterior cruciate ligament lives. This first little bit that we're shaving is actually called the ligamentum mucosum. It's just a soft tissue attachment. The ACL, the actual anterior cruciate ligament, is behind that. It's actually right here. You can see those fibers right there. And the ACL runs up and inserts on the lateral side here. It runs up in the direction of the shaver. So the ACL looks great. We're going to go off on the video for a minute because next we're going to look in the lateral compartment. Okay, so now we're looking up at the patella. This is the undersurface of your kneecap, and it looks like it's got some arthritis on it too. And what I mean by that is the cartilage looks a little bit rough here. I'm using the suction just to make sure there's no loose cartilage. Sometimes we'll look at this, and when we turn the suction on, little flaps of cartilage will fall down, and those can cause symptoms also. So that's the patella. I don't think there's anything else to debride there. These are the type of findings where we often have people come back to the office every couple years for injections that fall under the category of regenerative medicine. So now we're looking at the trochlea. This is the groove on the distal femur that the patella glides on. So every time you bend your knee, the patella hits this. And so we know you've got some arthritis on the patella here, but it looks like the trochlea looks pretty good, right? As we look at this, I'm trying to pull it out of the way, the fat pad out of the way. This looks pretty smooth, and we can follow this all the way down to the front of the knee, all the way down here, and if we go all the way down, that's where the ACL is. So there's the ACL is going to be right there. So there's the middle of the knee, that's the anterior cruciate ligament. The trochlea is this area here. It's nice and smooth. It looks disorienting because it does look so good. It's nice and smooth. And so trochlea doesn't have any arthritis, the patella does. And I think we're going to have one more good look around just to make sure we don't miss anything, but otherwise I think we're going to get you back to the recovery room. So good luck to you now. Bye-bye. Okay, so what you can see here in the lateral compartment is a little bit of fraying on the inner edge of this lateral meniscus. Not too bad. there was definitely more tearing on the medial meniscus, and I think this is something we can usually easily take care of with the shaver, which is what we're doing. I don't see anything else unstable. So now as we look towards the posterior horn of this lateral meniscus back there looks good. Just like on the medial side, a little bit of cartilage thinning, but not bad. Pause.